Hello everyone, my name is Anne, and today I am going to talk about Fondaparinux, also known as Ariska. A little bit about Fondaparinux. It is an anticoagulant. It works by inhibit factor 10A. It is indicated for prophylaxis of deep vein thrombosis. It can be used for treatment of acute deep vein thrombosis and acute pulmonary embolism. So how does Fondaparinux work? Fondaparinux is a synthetic pentasaccharide that causes an antithrombin 3 mediated selective inhibition of factor 10A. So what it does is binding to AT3 potentiates the innate neutralization of factor 10A. The neutralization of factor 10A interrupts the blood coagulation cascade and inhibits thrombin formation and thrombus development. For dosage and formulation, Fondaparinux comes in these following single-dose prefilled syringes: 2.5 mg, 5 mg, 7.5 mg, or 10 mg. The dosage for prophylaxis of deep vein thrombosis will be 2.5 mg sub-Q daily. So we should be administered the initial dose no earlier than 6 to 8 hours after the surgery. Administration of Fondaparinux earlier than 6 hours after the surgery increases the risk of major bleeding. The doses for deep vein thrombosis and pulmonary embolism treatment will based on the patient body's weight. If the patient body's weight less than 50 kg, the dose will be 5 mg sub-Q once a day. If the patient body's weight from 50 to 100 kg, the dose will be 7.5 mg sub-Q once a day. If the patient body's weight more than 100 kg, the dose will be 10 mg sub-Q once a day. For dose adjustment, we should be paying attention to patients who have renal impairment, in which their creatinine clearance is less than 30 ml per minute. However, in patients with hepatic impairment, there is no dose adjustment necessary in adult and pediatric patients. There are some important warnings and precautions we should be aware of while patients on Fondaparinux. So spinal or epidural hematomas, including subsequent long-term or permanent paralysis, may occur with neuraxial anesthesia or spinal puncture in patients anticoagulated with low molecular weight heparin, heparinoids, or Fondaparinux. Fondaparinux increases the risk of hemorrhage in patients at risk for bleeding. Fondaparinux may increase the risk of bleeding in patients with renal impairment. In patients less than 50 kg, the clearance of Fondaparinux is reduced by 30%, and the risk of bleeding is increased. Thrombocytopenia is one of the side effects of Fondaparinux. One of the most important monitoring parameters we should be measuring the patients who are on Fondaparinux is prothrombin time and activated partial thromboplastin time. We also need to monitor CBC, platelet count, serum creatinine, and also signs and symptoms of bleeding. And that is it for my presentation about Fondaparinux. Thank you.